Welcome parents-to-be to our antenatal breastfeeding talk. Here is some important points to note before the talk starts. If you would like to look at today's content again or refer to more details, you are welcome to visit our department website. There is a pregnancy app which is launched by hospital authority. You are also welcome to download. It provides information including all the health information during the antenatal period, your nutritional needs, information regarding breastfeeding and postnatal care. It also provides information of our obstetric units in all public hospitals. It can act as a record of your health status, such as blood pressure and blood sugar levels. You can also use it to record all of your antenatal appointments. In addition, it has a very practical function such as the contraction timer, which you may find it very useful on your delivery day. Department of Health has launched an app called Info for Nursing Mom. It provides comprehensive information and practical tips regarding breastfeeding that we encourage all expecting parents to download. World Health Organization recommends exclusively breastfeed for the first 6 months of life and should continue to breastfeed up to 2 years of age or beyond. Complementary food should be introduced after 6 months. Queen Mary Hospital is a baby-friendly hospital. We promote, protect, and support breastfeeding. We have established infant feeding policy and committed to provide a breastfeeding-friendly environment. Breast milk provides baby with enormous benefits. It is tailor-made for your baby and has all essential nutrients and components that baby needs for its developing system. Do you ever wonder what's in breast milk? It contains a lot more essential nutrients than formula milk, such as immunoglobulin, growth factor, immunity cells, enzymes, and etc. Even 1 drop of breast milk contains many white blood cells protects against infections, whereas formula contains no living cells or white blood cells. Breast milk helps baby's brain development, support retina development, contains special enzymes to ease digestion and absorption, improve baby's immunity by lower the chance of getting ear infection, meningitis, diarrhea, and protects long-term health by lower the chance of having obesity and diabetes. Breastfeeding also provides mother with many benefits. It is convenient, saves time and money. Breastfeeding helps uterus to contract after birth and therefore reduce bleeding after delivery. Breastfeeding also reduces body fat, helping mother to regain pre-pregnant body shape. Also reduces the risk of osteoporosis, breast cancer, and ovarian cancer. For society, breastfeeding reduces the risk of infection and chronic disease, causing less medical expense. Breastfeeding also helps to protect the environment by making less industrial waste. Exclusively breastfeeding for the first 6 months of life provides adequate calories, nutrients, and water. Breast milk alone is good for gut protection. There is no need to supplement baby with water or formula. Breast milk protects gut from allergen penetrations by forming gut protective factor along the digestive tract. Supplement baby with formula or water will, however, damage this protective barrier. Why extended breastfeeding for at least 2 years provides benefits? Young children's immunity matures at around 2 to 3 years old. Extended breastfeeding ensures they are well protected by intaking immunity cells through breast milk. Breast milk continues to provide adequate calories and nutrition after introducing supplementary food. Extended breastfeeding also allows baby or young child to experience different tastes through breastfeeding. Suckling on breast helps oral muscle development, which is essential to coordinate speech. Unnecessary supplementation with formula affects breast milk intake and interferes breast milk production. Using teats or pacifier during early days after birth may cause nipple confusion, and hence affect breast milk emptying and reduce breast milk production. Formula is not sterile product. Risk of infections increases if preparation of formula is inappropriate. Hormonal changes triggers breast tissue areola, causing darkening of areola and milk duct changes during pregnancy. Colostrum starts to produce at around 20 weeks of gestation. Different size in breasts produce the same amount of breast milk. Different sizes only means difference in fat storage, not the amount of milk duct. Let's move on to talk about breast milk production mechanism. Frequent baby suckling and effective emptying of your breast helps to establish milk supply. Milk production is positively associated with proportion of breast emptying. If milk stasis, breast will not further produce milk and cause involution. There are two hormones that are responsible for milk production: prolactin for milk production and oxytocin for milk ejection. Prolactin has higher secretion at night, therefore nighttime feeding will help to maintain supply. While baby suckle, oxytocin causes breast muscle contracts and secrete breast milk. Oxytocin also helps uterus to contract and hence reduce post-delivery bleeding. However, stress will bring down the oxytocin secretion level, therefore suppresses letdown reflex. In conclusion, in order to establish successful breastfeeding, it takes few things to happen: frequent suckling, effective breast emptying, and relaxation. Breast milk being produced in early days we call colostrum. It is yellowish liquid, condensed, and little in amount, but rich in immunity cells. Baby's stomach in the first 1 to 2 days is only as big as a cherry. Therefore, colostrum fits perfectly to your newborn's needs. On day 3 or 4 after birth, you may experience an obvious breast change. You may feel your breast becoming heavier, more swollen with visible vein. Your milk production gradually increases in amount with the change of color from yellowish to more creamy white. So in general speaking, there are 3 stages of milk production. Colostrum stage, usually within the 5 days after birth. Transitional milk happens roughly from day 5 to day 10. Mature milk from day 10 to day 14. Fat content gradually increases in transitional milk and mature milk. So why baby needs to nurse so frequently? It is because their stomach size is so small, but baby grow at a rapid rate during the first year of age. Suckling also gives baby comfort and provides sense of security. Therefore, baby need to nurse more to compensate their growing and psychological needs. The success of breastfeeding takes a good start. A good start means, first, connecting with baby during pregnancy. Second, early and sustained skin-to-skin contact. Third, respond promptly to your baby's feeding cues for feeding. Finally, support from your family. So why it is so important for parents to develop a positive relationship with their unborn baby? It helps mother and father to be more responsive once the baby is born, which is good for baby's development. You can do so by understanding the different developmental stage during pregnancy. Interact your baby by having a nickname. Talk to your baby or sing to your baby more often. Involve your partner and siblings. Prompt and responsive parenting promotes bonding, which is good for your child's brain development and good for growth. We encourage early bonding. You are advised to start connecting with your unborn child during pregnancy. After birth, you can start skin-to-skin contact immediately. In our hospital, we practice 24 hours rooming in postnatal ward. Baby will stay close to you to facilitate your prompt response to your newborn's needs until you and your baby discharge. We call the first 2 hours after birth the golden 2 hours. We encourage early and immediate skin-to-skin contact after birth. If your baby shows feeding cues, you should let baby explore and take a big mouthful of breast. This is the best time to start breastfeeding and stimulate milk supply. Research also shows that if your baby can latch by her or himself the first time, the successfulness of established breastfeeding will greatly increase. Why skin-to-skin contact is so important? Skin-to-skin contact helps to calm mother and baby, keeps baby warm, and regulate baby's heartbeat and breathing. It provides better immunity by letting baby to intake mother's skin flora. It also facilitates loving relationship to aid baby's brain development, and it gives a good start to breastfeeding. We delay the first bath in Queen Mary Hospital. Delaying the first bath has several benefits, including less interruption to skin contact, keeps baby warm, reduce newborn infection, allow time and space to let baby familiar with mom's smell and facilitate breastfeeding. We practice 24-hour roaming in Queen Mary Hospital, regardless to how baby is born and your feeding option. Roaming in facilitates mother to observe baby's feeding cue, allow prompt response to baby's need. Roaming in also reduces infection and the risk of sudden infant death. 24-hour roaming in helps mother and baby to bond and establish loving relationship. Responsive feeding means feeding on your baby's needs. There is no limitation and restriction to feeding schedule. Responsive feeding also stabilizes baby's emotion and hence reduces stress. When baby feels loved and secure, there will be less crying and stress. Good bonding with baby promotes oxytocin secretion, which aids baby's brain development. The best time to feed is when your baby shows feeding cues. There are 3 stages of it. When baby shows early feeding cues, they usually turn their head left and right, have mouth open, and will suckle on their hands or fingers. Middle stage feeding cues involve more physical movement. If you miss these 2 stages, you will finally see an angry baby with agitated cry. You should start feeding when they show their early feeding cues. Try not to wait until they give you a big cry. Prolactin secretion reaches peak at nighttime. Interestingly, baby is also more awake and has more nursing needs at night too, which is in a way stimulates and protects breast milk production. WHO recommends exclusive breastfeeding mothers should feed around 8 to 12 times per day. Here is some practical tips for breastfeeding mothers. New mothers are encouraged to bath or take shower daily. Change maternity pad frequently. Wash hands before and after diaper change. Use of adequate pain relief because pain will suppress your letdown reflex. Try to breastfeed at a comfortable place with nursing pillow. There is no need to clean your nipple before feed and make sure you wear a comfortable nursing bra without wire. So what do you need to set up your breastfeeding place? When you breastfeed, your back should be well supported. Use a pillow to support your arms and use a small stool if your feet cannot touch the floor. Getting yourself comfortable is very important because comfort promotes oxytocin secretion. When you position your baby, you need to make sure baby's head and body in a straight line and baby's body turned to face mother. Hold your baby close to mother. Have your baby's nose pointing to nipple and make sure baby's head is able to tilt back a little until chin touches the breast but not the nose. Let's take a look at the breastfeeding position video. There are 4 commonly used breastfeeding positions. They are transitional, cradle hold, football, and sideline position. Transitional hold is when you feed on one side of your breast with the use of opposite arms to hold and support your baby. Cradle hold is when you feed on one side of your breast with the same side of arms supporting baby. Football hold means you position baby under arm, and sideline is when you do breastfeeding lying down, you and your baby lying on the side and facing each other. So how to make sure you have a good latch? First, position your baby properly with your arms and legs and back well support. Position baby according to the principle we mentioned earlier. Make sure baby's nose pointing to your nipple. Have your forearms support baby's body, head and neck. When baby's mouth wide open, bring baby to your breast. Let baby's lower lip touches your breast first, then upper lip to ensure baby takes a big mouthful of your breast. Effective suckle means baby takes more of your breast tissue and baby suckle both areola and nipple. This is a mother's view when latching a baby. A good latch should be asymmetrical on breast. These are another set of pictures to illustrate how to bring baby to breast. After latching your baby, there are signs of good attachment you need to observe at each feeding. You have to make sure baby's mouth wide open, lower lip turned outward, chin touching breast but not the nose. Baby's cheeks should be round without dimple. You should be able to observe more alveolar above upper lip area but less at the bottom lip. Baby's suckle should be fast and shallow in the beginning, then change to deep and slow. Your nipple should not be painful when baby latch, and baby should be able to unlatch and feel satisfied after feeding. How do you know if your baby is taking enough? Baby should feel satisfied and able to settle after feeding. After adequate intake, baby should be able to produce enough wet and dirty diapers with good weight gain. You should be able to observe breast change after feeding, or breast will become soft after feeding. There is no fixed schedule to breastfeeding. During the early days, let baby suckle both breasts and rotate breasts alternatively as the first breast when offered. After milk comes in, let baby finish one side of your breast first. If baby still interested, offer the other side. Alternate breasts at each feeding. We need to monitor baby's output frequency and check baby's body weight to evaluate if baby is taking enough milk. In the first 1 to 2 days, baby should be able to produce 1 to 2 times of urine and have 1 to 2 times of bowel movement per day. The stool newborn produced during the early days is called meconium. On the 3rd to 4th day, baby should be producing 3 to 4 wet diapers per day and have at least 1 time of bowel movement per day. The stool color should be getting lighter or more yellowish. From 5th days onwards, baby should be able to produce at least 5 to 6 wet diapers per day. Each wet diaper should contain about 3 tablespoons of fluid or equivalent to 45 cc of fluid. Stool color should be mustard yellow and be larger in volume. If your baby is satisfied, he or she will come off your breast and able to settle for a while. Together with stable weight gain, it means your baby is taking enough. However, most baby will lose some weight in the early days and it is very normal. Baby with normal weight gain will eventually be able to regain the birth weight by day 10 to 14. During the first 4 months, baby should be able to put on at least 500 grams per month, and by 6 months old, baby's body weight should be double the birth weight. Under some circumstances, for instance, baby mother separation, breast engorgement, or for storage purpose, mother needs to do breast milk expression. You should start with hand hygiene and a clean milk container. Relax and do breast massage, or you can use warm compress if you feel engorged. Express 7 to 8 times per day to keep up the milk supply, and express at least 1 time at night. You should always start expressing by doing breast massage to stimulate milk ejection reflex or let down reflex. And then you can do a C-shaped hand with thumb and your index finger. Place your fingers on breast with index and thumb 2.5 cm away from nipple. Press towards your chest and then bring 2 fingers together. You should be able to see breast milk comes out from your nipple. Now let's move on to talk about normal baby physiological change. Some babies will have cluster feeding behavior during the early weeks. Babies will bunch feet close together at certain times of the day. Very often it's at night time, but after a period of cluster feeding, baby usually have a longer stretch of sleep. If your baby seems to be more unsettled at certain time of the day, this is only their normal newborn behavior. You should always observe the overall feeding in a day. If you are concerned when babies seem to be more unsettled, parents should observe baby's output frequency to ensure baby's hydration is adequate. If on the other hand your baby is more sleepy, you can wake baby up by firstly change the diaper, sing a song or stroking baby's hand or feet. Slowly unswaddle your baby, or you can try burping your baby. Neonatal jaundice is physiological and is part of newborn stage. Newborn carries extra red blood cell at birth. While baby is still inside mommy's womb, this extra red blood cell responsible for delivering nutrients to fetus. But however, after birth, baby's liver will break down this excessive red blood cell. A byproduct is then formed during the breakdown process called bilirubin. Bilirubin will then be removed from baby's body by urination and bowel movement. Jaundice is when newborn accumulate high level of bilirubin. Neonatal jaundice presents with yellowish color skin. Baby usually feeds poorly, sleepy. Eye white turns yellowish with signs of dehydration. There is a myth about whether breastfeeding needs to be suspended if baby is jaundice. The answer is no. Instead, parents should ensure baby is feeding frequently, as passing stool and frequent urination helps baby to eliminate bilirubin and brings down the jaundice level. The lactose that breast milk contains helps baby's bowel movement. There is also no need to supplement formula or glucose water. Breastfeeding mother should make sure baby is effectively breastfeeding. If you're in doubt, please contact lactation consultant. Have you thought of how to soothe a crying baby? Baby cries for many reasons. Crying is a way for babies to communicate with us. Babies will cry for hunger, thirst, attention, sense of security, or physical discomfort. Most parents will instantly link crying to hunger. As long as your baby produces enough wet and dirty diapers and have satisfactory weight gain, your baby's basic physical needs has met. I think we will all agree that it takes a lot of patience and sometimes can be frustrating to take care of a fussy baby. All you need to do is to stay cool and observe, try to rule out sickness and physical needs, and then step by step soothe your crying baby. Most baby cries for their physical and psychological needs. For example, the needs for diaper change, needs for sleep, needs for attention, and needs to accompany. And yet, baby cry for attention when they are tired and sleepy. They cannot just fall asleep by themselves. They need help to go to sleep. The environment being too loud, too quiet, too bright or too dark, too hot or too cold. Can you guess what your baby will do if he or she feels tickled of a hat that you put on them? Here are some practical tips to soothe your newborn. As crying causes stress to babies, we do not recommend you to leave baby to cry for a long time. First, most newborns enjoy being swaddled. Swaddling is also a commonly used technique in hospital to soothe newborns. You are welcome to speak to our staff or assistant if you're interested to learn. Second, reduce environment stimulation. Try to adjust the noise, brightness, and temperature to the level that suits your newborn the most. Be reminded not all babies like quiet environment. Babies used to hear different noises during the time being inside your womb. Some babies respond well to white noise, such as heartbeat sound or mechanical noise. Third, you can try baby massage. Babies really enjoy being touched and some find stroking movement very soothing. Lastly, gentle rocking or carrying newborn with sling reminds newborn the time being inside the womb and being carried around, which gives newborns a lot of sense of security and comfort. Last but not least, you can simply just hold your baby in your arms or continue to do skin-to-skin contact at home when they cry. Hugging your baby has a wonderful calming effect and it is very good for your baby's development. Despite all the effort to calm your baby is still crying? First, take a deep breath, relax and get help. If you are alone, it is okay to take a few minutes break, then try again. Remember, you are not alone on this parenthood journey. We cannot read baby's mind, but there is one thing that is always true. Babies love to be with their mothers. During the first few months after birth, babies will go through several rapid growth periods we call growth spurts. The initial growth spurt starts at around 2 to 3 weeks old, another one around 6 to 8 weeks old, and expect more of growth spurts at around 3 to 6 months. Baby will show a little different feeding behavior. They seem to want more feeding and get hungrier. Don't worry and keep offering your breast according to your baby's needs. Remember, temporary frequent feeding helps to boost your milk supply. If taking care of yourself and baby becoming overwhelming after birth, you should ask help from your partner. Partner's role is especially important after birth. With the help from partner to share household chores and prepare meals, mother can earn more time to rest and recover. Small gestures such as partner or husband may help to prepare baby before handing over to mother for breastfeeding, like changing diaper, would be a great idea to share newborn care. Partners can also arrange other relatives visiting time. Remember to share parenting meals to each other and spare time for dating. Let's move on to diet during breastfeeding. Breastfeeding mothers need to have well-balanced diet with extra 500 calories a day. Make sure hydration is adequate. Avoid unhealthy fats, food or drinks contains high level of sugar and smoking. Limit your consumptions of alcohol and caffeinated drinks. Let's move on to talk about common breastfeeding problems. Sore nipple is commonly seen when baby's latch is not correct and improper. If sore nipple observed, make sure the attachment and position of baby is correct. The mother can apply your own breast milk over nipple and areola to relieve the soreness or use lanolin. You can continue breastfeeding if the pain is tolerable. However, if pain persists, you should speak to our staff or consult a lactation consultant. New mothers may experience breast engorgement after birth, which usually happens 3 to 6 days after birth. It's a feeling of fullness, heaviness, tenderness, and warmth over your breasts. New mothers should have early and frequent breastfeeding, responsive to your baby's feeding needs, and make sure your latch and position is correct. Gives baby no supplement unless medically indicated. If engorgement persists after feeding and baby is satisfied, you can use cold cabbage leaf or a bag of frozen vegetables to apply over your engorged breasts. If engorgement persists, please talk to our staff or speak to our lactation consultant. For breastfeeding mothers who is planning to go back to work after maternity leave, you can prepare in advance by discussing your needs at work with your employer or supervisor and colleagues. Talk to your family about your baby feeding choice. Right after birth, new mothers should nurse frequently to build up milk supply and learn how to manually express your breast milk. 2 weeks before going back to work, you can start to build up your milk bank and introduce bottles and teats to your baby. Try to ask help from other family members to feed baby with bottle to ease the process. Prepare your pumping equipment. When you are back to work, try to breastfeed right before and after work. Have 1 to 2 times of lactation break during work. Have your baby's photo or video ready to stimulate letdown reflex when you pump. Balance work and breastfeeding. Seek professional help if there is any issue with your breastfeeding during your breastfeeding journey. You are welcome to call to our breastfeeding hotline or seek help at Maternity Child Health Center. If you have any questions, you are welcome to join our breastfeeding Zoom class for interactive Q&A session. You can get breastfeeding support by calling us at our breastfeeding hotline after birth or get community support by speak to staff at Maternity Child Health Center in your neighborhood. If you think you have an in-depth problem that we need to handle face-to-face, you can consult a lactation consultant at our breastfeeding clinic. Here we come to the end of our breastfeeding talk. We wish all parents to be all the best, smooth and successful breastfeeding. See you soon!